When I found out I had a heart attack and that I wasn't able to work anymore, I went to see a lawyer, and they suggested that I open up a trust account. I'm glad that trust was open, because if I didn't have the trust, now I'd be paying for everything out of my own pocket, and I'd be totally broke. So I don't worry as much now as I would have if I didn't have the trust. Figure, well, how am I going to pay this bill? How am I going to pay my rent or pay my food or my cable bill? I don't have to worry about that because I know the money is there.
The NYSARC Trust itself was created as a third-party trust to provide parents a way to put away monies for their disabled child so that they can be used during that person's lifetime. It's the largest trust of its kind, not only in New York State, but from what we understand in the United States, that provides these services.
We provide them with a safe harbor, a place where those monies can go and be held on their behalf and in the future spent on their behalf without negatively impacting their eligibility for government benefits.
By having the trust, I'm able to keep my health insurance. If I didn't have my aid with me, number one, I'd be lost. I wouldn't know what to do. I don't want to be injured. So if I ever fall down, the aid is there.
We have provided our beneficiaries and our beneficiaries' liaisons with every last single thing they have needed to remain in compliance with the Medicaid program and the Social Security programs. And that has proven to be very effective on their behalf in maintaining their eligibility for those benefits.
People who have these disabilities have a life, and they should be able to serve that life, to enjoy that life. That money can be used for things like recreational trips, television sets, for other things, and for rent so that they can live in their own homes, that they can have cars. These are the things that can make a life a lot better and make it much more enjoyable.
I bowl on Thursdays and Tuesdays. I enjoy it. I can interact with my bowling members. Without the trust, I wouldn't be where I'm at today.
Most of our clients prefer to stay in their home. That's not a surprise. Helping them stay in their home, it's better outcomes for their health, for their mental health, for their physical health. It gives them a much better quality of life if they can stay in the community. So by utilizing all these different resources, such as Medicaid and NYSARC Trust Services, we really help people stay in the community where they want to be.
So my father had a pretty bad stroke about 15 years ago. As his ability to get around and his mobility reduced, we really needed to make sure we had a good plan in place. We had a team that included his physicians. We had a caseworker. We used the NYSARC Trust for his Medicaid spend down. We were able to keep my dad at home with my mom, happy and healthy, right up to his last day.
We have a lot of clients that still live with family members so that they can contribute to the household bills, the utilities, the groceries, even paying rent. Really does allow the family unit to stay together. And in most situations, that's a much preferable circumstance, being institutionalized.
We have a tremendous staff in our benefits department who develop relationships with beneficiaries and beneficiaries liaisons. Our staff get to know the beneficiaries.
So one of my favorite things about working with NYSARC is being able to pick up the phone and have access to a team of folks that are working on behalf of our clients. The customer service at NYSARC is so phenomenal.
When you find the NYSARC Trust to be able to manage your spend down and you're enrolled and you're set up, it's so easy. As a caregiver of somebody that has physical implications like my dad had, it can be really tough and it can be exhausting. When we got to the point that we needed 24/7 care, we knew that was the right recipe for my dad, where he could be healthy and happy at home and still spend every day with my mom. And what else could you ask for? My sisters and I were really grateful to have that.
So I've worked with NYSARC probably close to 20 years, and I've utilized the pool trust, I've utilized the third-party trust, and I love working with NYSARC. Also because NYSARC has such experience in helping clients who are receiving Medicaid. And I love recommending NYSARC to my clients because it's an organization that's been around for a long time, and I know it'll be there in the future for them and their families.
Under the provisions of the law, we can keep the funds of a first-party trust when that person dies, as long as it's used for agency purposes. It has been a real source of pride to see how much that has assisted in the various chapters to allow for the guardianship program, for the recreation program, and for other programs to continue.
I'm kind of in awe. When I think of 25,000 people passing through trust services over the years, one way or another, that we have helped, it's a lot of people.